I'm Brittany Pinto. I am a licensed psychotherapist working at Boutique Psychotherapy in New York City.
I also work at Boutique Psychotherapy. My name is Kimberlin Shepard, and I am also an LMSW and am an individual and couple psychotherapist.
I support patients that are impacted by cancer, going through treatment, survivors. We have an affiliation with Mount Sinai's Woman to Woman program, and other than that, a lot of general anxieties, depression, dating and relationships, and general struggles.
What does intimacy mean to the two of you?
Yeah, intimacy is a very multifaceted concept. On a very general level, I would say it means closeness and connectedness with not only yourself, but with others, and others meaning platonic relationships, romantic relationships, the way that you interact with the world. It can mean anything from emotional intimacy, being in touch with your emotions. It could mean intellectual intimacy, spiritual intimacy, experiential, physical, and those are what we like to group as non-sexual intimacy. And then of course there's sexual intimacy, which is sex, intercourse, foreplay, more of the physical aspects of intimacy, but they all impact who you are and your emotions on a very deep level.
Why it's so important for us to think about intimacy beyond sexual intimacy?
A big thing that we focus on in our work with our clients is the idea that all of these different types of intimacy, like Brittany mentioned, emotional, intellectual, communication, conflict, all of those types of intimacy impact your sexual intimacy. And like most of us know, without the emotional connection, having a sexual connection can be really challenging. So making sure that you feel in tune on all of those different levels can really impact your sexual functioning and your sexual desire with yourself and with a partner.
Why might someone want to come see someone to talk about sexuality and intimacy?
Going through anything really, especially something like cancer, can be emotionally taxing, can feel lonely, and it's important that you not only lean on friends and family and your own intuitions and your own emotions, but also have an outlet to talk to an unbiased person, specifically someone we didn't mention, but Boutique Psychotherapy, all of our clinicians are what we call medically informed. So we're very familiar with medical jargon, medical diagnoses and treatment. So it's nice to be able to have us as an outlet, like one of our clinicians, so that they don't need to explain exactly what they're going through. Of course, we want to know what's going on inside and deep down from an emotional perspective, but we know the medical terminology, which is really helpful that they don't need to come and have another clinician that they need to explain something to. So from an emotional perspective, seeking a therapist is really helpful to just be able to process things with someone else.
Mm-hmm. And then at Boutique Psychotherapy, we also have various sex therapists, and someone that may have been impacted with cancer could potentially seek out a sex therapist. Also somebody that's not impacted by cancer, of course, but the reason to see a sex therapist after ruling out any medical concerns, of course, a sex therapist can help you in reestablishing intimacy and pleasure, and if you're experiencing any kind of pain or discomfort when it comes to sex, or any kind of sexual dysfunction, a sex therapist can be really helpful in reestablishing that mind-body connection in order to get back to a place of enjoying sex both with yourself and with a partner.
Why is something like that especially important for people impacted by cancer?
That's really when a medically informed clinician is really helpful, because we work with a care team and we're familiar, like I said, with medical terminology and what's typical for certain kinds of diagnoses and treatment. Of course, there's no playbook, there's no script for a cancer diagnosis, and it's not a one-size-fits-all approach, but typically with help from a care team, we'll be able to guide you in the right direction of what might not feel normal and what is normal, and just be able to keep you on track, because obviously with any sort of medical illness, including cancer, there's a lot of what ifs, there's a lot of questions, there's a lot of anxieties. So just being able to really have concrete answers and advice and be able to keep people on track, that's really important, and why it's helpful to seek a medically informed clinician.
Is there anything that you see in the patients you work with who have been impacted by cancer that come up often?
A lot of work around loving yourself and loving your new body and getting comfortable with the change that has occurred both on a mental and a physical level. And something that is really impactful is focusing on your language and how you talk to yourself, and also not pushing down those feelings. It's okay to experience negative emotions and have those kind of responses to change and any experience that you have in life, but also knowing how impactful our language is and having positive self-talk and relearning to love the body that you have and that has gone through so much and has gotten you here, while not ignoring, like I said, everything that you've been through, because both of those feelings can exist at the same time, having really negative thoughts and also being really grateful to be here and everything that your body has been through.
Can you give an example of how you might coach someone through that?
Something I really lean on, any kind of patient that we're working with, specifically cancer patients, is really getting in touch with your feelings and your emotions. And yes, that's great to be able to process with a safe person in the room that you feel comfortable and vulnerable with, but also doing it on your own. Waking up in the morning and setting time aside to meditate and really get in touch with your body, mind-body connection, so important. And also journaling, writing down what comes to mind for you, and in a way that not anyone's looking at. It's really just for you, a place to free write, can really just give you space to feel your feels.
Is there anything else that you think is important for the Breasties to know about intimacy, about sexual health, anything like that?
I think giving yourself grace and knowing that, like any life experience and any change that occurs for you, it takes time, it takes patience, it's not gonna happen overnight, and to not beat yourself up for those negative thoughts that you have and you've never been in this experience before, and accepting that and acknowledging that it's tough and giving yourself that grace to get through it and to persevere and just be really intentional with the fact that you can do it and you have done so much, but being patient and not dismissing those negative feelings, because by pushing those down, they're only going to come back later, and really working through them with the support of whether that be a therapist or your support network of friends, families, whoever it is, but really talking about it and leaning into those feelings.